One of my huge passions in life is to manage pain. And one of the big pain things that I treat is migraines, and I do it in a way that no one in the world does. And I literally don't think anyone in the world does it this way because I invented this method. So the problem with traditional migraine treatments is that medications are not great to take them. In addition, they don't really fulfill the need of stopping all migraines. And so that's a pretty tall order that you're suggesting, and it is. But my goal with my therapy is that you never have another migraine attack and you're off all medications. And that's something that I can oftentimes deliver, if not always deliver. So I want to clarify sort of, what I'm treating and how I'm doing it. So I'm using Botox, and oftentimes when you hear that, you think, oh, that's going to be sort of like what my neurologist is doing. And it really is absolutely not like what your neurologist is doing. Neurologists use way too much Botox and they get way too little result from it. And the results are just not good enough. And, some reduction with some medical therapy is a complete failure, in my opinion. Remember, my goal is that you never have another episode, or the episodes you do have are very minor and you're off all medications. And this is going to blow your mind, that if you have an episode, that I can wipe out that episode in 1 second with my Botox. So I had a patient recently cancel because she had a migraine. It's the best time to come in. I can even target it better if you have a migraine, but I can actually get rid of that migraine. I can take a visual aura and completely eliminate that visual aura in 1 second. So first of all, who meets the criteria for a good migraine therapy and who doesn't? So in general, I believe that I can treat most migraines with Botox. Something that's harder to treat is when the migraine is coming from way inside the head and it comes out with a qualification. So if it comes from inside the head, I can't really Botox it well. But if it starts somewhere here, vaguely, the Botox still works incredibly well to treat it. The trick, though, is a very targeted solution. So sometimes they say it's inside the head, but actually what they mean is right here. And there are these pain points right in this area that work really well. So you have to delineate when, and that's the qualification, what someone means from inside the head. If it's really sort of inside the head, but it really is right there, here, I can manage it. A question that people have asked me is like, well, wait a second, if you're doing a very targeted solution to this treatment and I don't have a migraine, how do you treat it? And the answer is that it actually is not that difficult. And here's the way it works. So I will ask you, where do they start? You'll say sort of in this area or around over here. Okay, good. So what is interesting is your nerves are still inflamed in the areas where you have a migraine. So and you're pretty good at your subconscious. You'll say, well, it's sort of around here. So what I'll do is I'll touch it and you'll go, oh, that's a little tender. When I go in with the needle, if that replicates the tenderness, I know I'm in the sweet spot. And you'll actually feel immediately like a relief, even if you don't have a migraine. And that's how I target these areas. And I can actually do 50 to 100 little injections. And the difference with the neurologist who's doing 200, 300 injections is they're missing the spots. And I am very convinced, if you've been to a neurologist, that this will be completely different from what you've experienced because they don't deliver enough. So I'll give you a funny analogy, and I've said this in my videos on acute and chronic pain management because I use the same technique to manage knee pain, finger pain, TMJ pain. I am also a patient. I do TMJ treatments for me. My nurse, I instruct her how to inject it. I wish I could inject myself because I actually know how to go through this systematically, but it's very hard to do that with me. And I'll be honest with you, I'm a little lazy to inject myself, so I have a Siri reminder to inject myself on repeat occasions. But bottom line is, let me give you an analogy to understand the difference between how I use Botox for migraines and how a neurologist does it. So a neurologist uses 200 to 300 units of Botox, and they systematically inject a wide area. The problem with Botox is it has to be placed exactly right. And so I look at myself like I'm a sniper with a laser target, and I'm sitting in front of you, the villain that I need to kill or wipe out, and I blast the shot. A neurologist is like using an assault rifle with a lot of ammunition, and they are blindfolded and the enemy is 10 miles away, and it's at night, and they're shooting randomly all over the place. They may hit the target once or twice. They may not even hit it, and there's targets everywhere. So they hit a few here and there, so there's a little bit of reduction. Whereas I walk right up to the front of that enemy and blow the head off. So I'm sorry for that violent image, but essentially that is what I am doing with these problems, as I am killing it. And I know for a fact it's there. In fact, my relief is instantaneous. Why can I get a migraine completely corrected in 1 nanosecond? Because I am doing it right there. And if you ask your neurologist, what is he talking about? They won't know, because I invented it and no one understands this. I'll be lecturing on this in October in Las Vegas. People do not understand how to do this. So pain is my middle name. I treat pain. I really, really manage pain of all kinds, and migraines are not that difficult for everything else. I've shot a migraine video in the past. I wanted to go and really refine it to understand how I do it. So I've really started to understand even a more comprehensive, systematic way of doing it. I find that if you say, well, Dr. Lamb, how are you doing it? If you just mentioned you may do 10, 20, or 30, or 50 injections, how is that different from are you just randomly shooting these? No, I am going through and hitting all of it. So an evolution from even early 2023 until now, and I'm shooting this in June right now. I've done this I've done a similar technique for 17 years, but I've constantly refined it. Is I find that a higher volume of injection in multiple small points is much more potent. So here's how I used to do it. I would ask you, where's the pain point? And I would hit 3 or 4 points, and you would feel incredible relief. Now what I do is I have you find the pain point, I inject the pain point, and I realize something. When that nerve is inflamed in that zone, it actually has multiple small tributaries or branches that are involved. So I'll go near it and I'll put more injections in. So I guess the analogy of the enemy is not a great one, but maybe it is. Maybe I'll say if there's an enemy there, let's say the enemy is an octopus, maybe that's better. So to kill the octopus has 8 tentacles sitting out there, I will kill the octopus in one leg, another leg, another leg, another leg, another leg, but I'm actually shooting the octopus. I'm killing the animal. I know there's a weird metaphor, analogy, or whatever it is, but I find that pain is not isolated to one point. Even though I can give massive relief on 1 or 2 points, and it'll be so much different from what your neurologist has had, the evolution I've had even over this year is to recognize that there are micro tributaries that I can manage and wipe out, and I can do it very quickly. So I'm actually eliciting some discomfort, but there is a complete wipe down of the pain. So people also don't understand that. I don't even understand that. I went back and pulled out an old encyclopedia on Botox to try to figure out how the heck does Botox work like the way that I'm seeing it, because if it's doing a postsynaptic block on the muscle, neuromuscular end plate, which is not what I'm treating, that it takes at least a few hours to work, and really sometimes a day to 2 weeks, but mine is instant. And I did accidentally walk into a lecture hall in San Diego a few weeks ago and overheard about this possibility of what's called transcytosis, meaning it goes through the cell. So I think it's doing some kind of neurologic modification in this area in a way that's profoundly amazing. As I said, I'm also a client. I'm also the one getting treated for this, and it's an incredible treatment for TMJ. If you haven't heard my TMJ video, I encourage you to watch that one. I only shot that a few weeks ago, and I'm constantly making minor adjustments. So if you heard my older migraine video, which is probably a little bit more thorough and comprehensive than this video in certain respects, but it's not as up to date. And so this is a better summary of the pertinent information to understand how I treat migraines. My goal is that you're completely migraine free off all medications with no more episodes. That's a pretty powerful thing. Now, I'll tell you one thing. I use the analogy of going to the gym. If you go to the gym and you want to lose 20 pounds, you may work you harder, you're not going to lose initially, and all of a sudden when you lose it, you don't need to go to gym as often. So I find the same thing with migraines. Even though my objective is to have no more migraines and you're migraine free, I may not get it all in one session. My goal is to make a radical improvement of the way your migraine situation. And then hopefully that after a few rounds, you are completely migraine free. And I'm hoping I can extend your time of needing to come back. Usually it's every 3 months, but if you have a lot of breakthroughs early and it's not lasting as long, I have to charge you again for it. I don't take insurance if that's a question of yours, but it's so worth it that if you compare me to anyone taking insurance, you might as well not even make the comparison because it's apples and oranges. But if I can get you clean enough with this and last you hopefully 3 months, my goal is maybe I can get you to 4 months. Maybe I can get you to 6 months, maybe even less often. Maybe you don't even need me anymore. Maybe you don't need me very often. Initially, it's going to be every 3 months, and it may not be 100% annihilation, and the first time may even be shorter than 3 months. But when I give you that kind of relief that you never experienced, I'm hoping that you are blown away with it, and I can really change a life. If you don't have migraines, you know someone else has migraines, please send this video to them. I'm so passionate to make this change. It's something that I think the world needs to know about, and I hope I can help you.